Hello, and welcome to the Public Health Shift audio edition. I'm Nadia. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 30. Consensus isn't the goal. Before we get started, I wanted to try something a little different. If you've been following the Public Health Shift audio edition, you'll know that my videos are usually voiceovers. But for this episode, I thought I'd step in front of the camera instead. And the reason for this is simple. This particular topic feels less like a technical discussion and more like a conversation, one that has been shaped by experiences I've had with different organizations, partners, and health systems over the years. So I hope you will enjoy this new format. And for now, let's talk about why successful stakeholder engagement isn't really about achieving consensus. One of the first things we are taught in public health is the importance of stakeholder engagement. Whether we're designing a new program, introducing a digital health solution, or developing a national strategy, stakeholder engagement is almost always presented as a critical step. And we have to identify the relevant actors to organize consultations, facilitate workshops, gather feedback, and work towards consensus before moving forward. And this is for good reason, because public health doesn't happen in isolation. And very few interventions manage to succeed without the support of the people who are responsible for funding, governing, implementing, and using them. But over the years, I found myself questioning two assumptions that often sit beneath our approach to stakeholder management. The first one is that stakeholder management begins when people get together in a meeting. And the second one is that success is achieved when everyone agrees. But I'm no longer convinced either of these is true. By the time stakeholders walk into the room, they have already formed opinions. Not necessarily about the project specifically, but about the kinds of changes that are being proposed. A ministry official may have lived through several reform initiatives that promised more than what they ended up delivering. A hospital manager may already be balancing staff shortages, budget constraints, and competing operational priorities. Frontline health workers may be worried that another innovation will simply create more work for them. None of these perspectives emerge during the meeting itself. Instead, they've been shaped over months or years by previous experiences, institutional culture, organizational incentives, relationships, and competing priorities. Yet, we often invest enormous efforts in designing the workshop agenda, while spending comparatively less effort in trying to understand the context that each stakeholder is bringing into the discussion. Perhaps that's because meetings are tangible, they are visible. We can point to them as evidence that engagement has taken place. But the conversations before the meeting, the informal discussions, the relationship building, and the effort to understand what matters most to different stakeholders often have a far greater influence on what actually happens once everyone sits around the table. I've come to believe that good stakeholder engagement starts with curiosity rather than consultation. Before asking how we can persuade stakeholders to support a proposal, perhaps we should first ask what pressures they are under, what are they trying to achieve, what risks are they trying to avoid, and what previous experiences are shaping how they will respond. Those questions won't just help us anticipate objections, but they will also help us understand the system that we're trying to change. This brings me to the second assumption. In many projects, stakeholder engagement is implicitly judged by the level of agreement reached. If everyone leaves the meeting aligned, we consider it a success. If disagreements remain, on the other hand, we worry that stakeholder management has somehow failed. But is complete agreement really the right objective? Health systems are made up of organizations with different mandates, different incentives, and different responsibilities. A finance ministry will naturally assess a proposal differently from a clinical team. National policymakers will have different priorities from district managers. Community organizations will often see risks that technical experts overlook. Expecting everyone to reach exactly the same conclusion ignores the diversity of perspectives that stakeholder engagement is supposed to bring into the process. In fact, some disagreement can be incredibly valuable because it helps to surface assumptions, it exposes implementation challenges, and reveals trade offs that may otherwise remain hidden. So the goal isn't actually to eliminate disagreement, it's to understand why there is disagreement. And perhaps the real measure of successful stakeholder engagement isn't whether everyone agrees, but whether there is enough shared understanding, trust, and ownership for implementation to move forward. Not everyone needs to think the proposal is perfect. It is that every stakeholder will see it through the same lens. The more complex the public health challenge, the less likely it is that every stakeholder will see it through the same lens. As we work on health systems strengthening, digital transformation, climate resilience, and other cross sector challenges, we will increasingly find ourselves working across institutions with different priorities, different constraints, and incentives. And that complexity isn't something stakeholder engagement should eliminate. It's something it should help us understand. And perhaps that's the biggest mindset shift, that stakeholder engagement isn't primarily about facilitating better meetings, nor is it about persuading everyone to agree, but rather it is about investing the time necessary to understand the realities that stakeholders bring with them long before the meeting begins, and to create enough alignment afterwards for meaningful change to happen. As always, I'd like to leave you with a few questions to reflect on in your own work. Before your next stakeholder meeting, how much do you really know about the priorities, constraints, and concerns that each participant is likely to bring into the room? Have you ever considered the stakeholder engagement process to be unsuccessful simply because everyone didn't reach complete agreement? Looking back, was consensus actually necessary? When you design stakeholder engagement activities, are you primarily trying to build support for a solution, or are you trying to better understand the system in which that solution will need to work? And finally, what would change in your projects if success were measured by shared alignment rather than by unanimous consensus? Thank you for listening. If you'd like to continue the reflection, you can read the full issue of my newsletter by subscribing to the Public Health Shift on www.nadiatecal.com. Until next time, take care and keep questioning how we show up in our work.